do you guys have any particular questions you want to start off with?
One question I was thinking about, because you know how I said in Tonga we don't go see a dentist. Maybe we're lucky we can see a doctor. But is that part, it can be included in your oral check with your GP? You know, talk to them about your teeth, you know, and they can refer you to a dentist while you're in that young age.
Yes.
Or
Yeah. I'm sure you already know, and actually it's a good thing to be discussing at this point with the election, because it's just everywhere at the moment. Everyone, dental care and subsidised or free dental care is just on all the politicians' radar at the moment. Whether they'll follow through or not is a different story, but I think that a long time ago, somehow dentistry got very separated from primary health. So just overall, you know, so I guess seeing your GP, it's became completely privatised. So full fees, even though it's still healthcare.
yeah,
You know, it just is. It's quite strange.
I remember coming to New Zealand in the 70s. It was, you go to the main hospital, and if you have like a problem with your teeth, but you tell the doctor at ED, they will refer you, and you'll be seen in the main hospital.
I can tell you about the services that they do have here in Christchurch. There are a few, but it's all income tested. You know, so I find that a lot of our Pacifica families actually work hard, you know, and long hours, and so they don't always fit into they're often in a working poor sort of class, you know, sort of bracket, I should say.
Yeah.
And so they don't meet the eligibility criteria often for some of the free services at the hospital. So most of the care that is available through the hospital system is a relief of pain type service.
Yeah.
So they will, you know, book you in and do sort of address one problematic tooth at a time, and if you have another one, you come back, and there is a fee, but it's a lot less than private practice, and WINS can support that. No one really wants to be heading down this track, but there are pathways if somebody needs all of their teeth out, because unfortunately things do get to that point, and that usually you need to at least have a community services card for that. There obviously Pacifica children are overrepresented within the group of kids with rheumatic heart disease, so they are actually eligible for care through the hospital system, in our DHB anyway. What other pathways are there? They're probably the main ones. It worries me that there's no subsidised care for people with diabetes, you know, because that is a huge group, and oral health has a big link with diabetes. Common risk factors, you know, sugar, diet, but in terms of, that's for adults,